Starting with photo 1, this is John Brown. He's a certified registered nurse anesthetist. John was extremely welcoming to sit down as he shared some insight into his job. He told me he's one of the responsible for putting a patient to sleep in preparation for procedures in the operating room, and also to ensure the patient wakes up afterwards. John said his primary focus while at work is to ensure patient safety. He said he spends a lot of time in surgery monitoring vital signs. He is so attuned to all the beeping that he can tell when a change in patient's heart rate by beeping alone. We talked about the requirements to become a CRNA, and he said it wasn't an easy task. First you have to have at least a bachelor's degree in nursing, a license as a registered nurse, 1 year full-time experience as a registered nurse in a critical care setting, and graduation from accredited anesthesia education program. We talked about some of the challenges John faces at work, and he said the stress is the biggest challenge. The stress is the hardest part of the job, but it's also extremely rewarding when everything goes right. The other big stressor of his job, he said, is the time away from his family. My second photo is of Stephanie Whitehead, a certified surgical technologist, or as she calls it, a scrub tech. Stephanie invited me into the operating room while she assisted Dr. Har, a general surgeon. Stephanie said helping with the surgery is just one aspect of her job as a scrub tech. She said that before she goes into the operating room, her responsibilities involve finding out what surgery and who the surgeon is so she can pull the necessary instruments required for the case. Assisting with surgery and after the surgical procedure, the scrub techs are responsible for cleaning, repackaging, and sterilizing the reusable instruments for the next surgical procedure. She said, in order to get into the field, you must complete an approved surgical technology training program. The hardest part is learning what each surgical case requires and the physician preference for each case. She did tell me her job is extremely rewarding and enjoyable, and she learns new things every day. For picture number 3, we have Chanda Lewis. Chanda is also a certified surgical technologist, and she works part-time in that role, but more importantly, she's an instructor passing on valuable information and knowledge to the next generation of medical professionals. Chanda said working as both a surgical technologist and an instructor is challenging and it can be time-consuming. She said her primary job is to ensure the needs of the students are met and that they have everything needed for their learning situation. She stated to become a surgical technology instructor requires being certified in the field that she's teaching in, as well as at least 5 years of experience. She said that even though 5 years is the minimum, having more experience is a huge asset and a more rounded in the field, thus providing a much more diverse training environment for the students. We talked about the challenges and benefits of the position as well. And while she said there is not many challenges, there are a few areas where she has to get creative. She said the benefits outweigh the challenges, like when a student passes a certification exam. But she said the best part about being an instructor is when she gets a call from a former student saying they have a job and they love their new career.